Hello, my name is Nicola Frazier. This video is focused on the use of remote collaboration in making evidence-based decisions. According to an article by Luce et al. In 2015, it states that the development and deployment of information technology, particularly mobile tools to support collaboration between different groups of healthcare professionals, has been viewed as a promising way to improve disease surveillance and patient care in remote areas. Telemedicine approach has been employed in urban areas with success in the diagnosing and treatment of diseases. Patients' geographical locations and easy access to specialist care continues to be a challenge in achieving desired patient outcomes. I will be discussing patient Caitlin Bergen and designing an evidence-based care plan to provide her with safe quality care to achieve a desirable outcome. Let me provide you with a bit of background on Caitlin. She is a 2-year-old who was taken to the emergency room with history of shortness of breath and elevated temperature. She was later admitted with pneumonia. This is her second admission within the last 6 months with pneumonia. She was nebulized, after which she was observed with thick mucus. She was seen by the physician who ordered the chloride sweat test because her lower extremities were observed with decreased sebaceous tissue, subcutaneous tissue. The sweat test was positive and she was diagnosed with cystic fibrosis. Caitlin lives with her mother in a remote area about an hour away from the hospital. The nurse is concerned about her day-to-day treatment upon discharge home. Her parents both work, and to get to the hospital to be educated about her condition is a challenge. But prior to discharge, her parents will be educated, followed by Skype consultation with one or both parents after discharge. The nurse and the doctor at the hospital reached out to Caitlin's pediatrician in her community via telephone to discuss her follow-up care. The doctors will consult via Skype, and telemedicine will be used for her medications in order to avoid an hour-long trip to the hospital if she has symptoms. The doctors will collaborate after hours by text message to maintain continuity of Caitlin's care. The evidence-based model used to plan care for Caitlin is through telehealth and telemedicine. A publication by Cadillac and Butner in 2017 described telehealth and telemedicine as two collaborative approaches that links healthcare organizations and patients from remote geographical locations and transmit text, data, images for clinical consultation and treatment. Since Caitlin's illness requires lifelong treatment, it is important to implement evidence-based strategies to alleviate an issue with the coordination of her care. She needs daily medication and daily chest physiotherapy, which is extremely important in managing cystic fibrosis. Skype is used as a means of communication between Caitlin's parents if they have any concern regarding her care. Without close monitoring and follow-up, Caitlin is at risk of developing chest infections or chronic diarrhea. For example, without her medication, she wouldn't be able to absorb fat and protein, which will lead to generalized weakness. It is important that her parents are adequately taught the correct techniques for chest PT to prevent injury. The hospital's respiratory therapist is available via Skype to address any concerns that her parents might have. The decision to implement the telemedicine approach was most relevant and useful in planning Caitlin's care because long commute to the hospital may pose a problem in receiving her treatment without delay. The interdisciplinary team that include the physician, Caitlin's pediatrician, the RN, social worker, and the respiratory therapist will collaborate and communicate via telemedicine, Skype, phone, and text message. This would benefit Caitlin as she will receive consistent care without the long commute. The use of an electronic health record system can help to alleviate any challenges the team may face. An electronic health record system allows for easy access to all healthcare professionals involved in Caitlin's care. This is necessary to monitor her progress and communicate as a team. Finally, the use of remote collaboration creates an environment to achieve better patient outcomes for those living in remote areas. Evidence-based practice models provide a framework to apply best practices in all healthcare settings.